Greetings of the day. I am Dr. Shweta Mathur Senior Consultant, Dental and Oro Maxillofacial Department, Apollo Hospitals Noida. And today I am here to make you a little conscious of your beautiful smile. Smile is a curve that sets everything straight. Smile is one's identity. Smile is the only emotion which has no sound. And therefore, smile should be carefully guarded and taken care of. Medically speaking, a smile is the first introduction that we have to the outer world. The smile can be controlled or is controlled by both hard tissue and soft tissue contours of the body. Hard tissue, namely the bone, the facial bone structures, and the teeth, which combine to form or shape your smile. And the soft tissue that contributes to the smile are the lips, the facial folds, and the gingiva. So today, I want to empower each and every one of you, my listeners, to design your own smile. To do so, you have to first know the significance of the most important aesthetic parameter that we follow is the E-line. Now, E-line is a line that you yourself can imaginarily create on your face. This line passes through the most protruded portion of your face, namely the tip of the nose. Now, this line, as it moves vertically down, when seen from the side, then you should be able to vision your upper lip 1 to 2 millimeters behind that line and the lower lip 2 to 3 millimeters behind that E line. So this E line becomes the parameter of your smile and your aesthetic value. The smile is dependent, as I have already said before, about the hard and the soft tissues. And today we shall talk about them one by one. When we talk about the soft tissues, we talk about lips predominantly. The shape of the lips, the size of the lips are handed to us down the generations, and the importance of genetic factor plays a role here. However, they can be remodeled, reshaped, recontoured by the most advanced plastic surgeries procedures, which we are not going to be covering here today, but we all know that it can be recontoured and redone. The color of the lips also makes an important role. The dark pigmented lips, which are commonly found in our genetic distribution of our country, can be overcome by lasers, depigmentation, and is a treatment that can be followed very easily in any of the dental setups that are empowered with laser depigmentation. The second soft tissue that contributes a lot to the smile of the patient are the gums or the gingiva. Predominantly, its visibility, their shape, their color, and their thickness. When we talk about their shape, we see that in a lot of patients, the gums or the gingiva are swollen, inflamed. These can be easily taken care of. Now, these become a sore eye in aesthetics when we smile and we see bleeding or swollen gums. If one takes good care of one's oral hygiene, this problem can be counteracted. However, even when some patients take good care of their oral hygiene, gingiva does pose a problem. Now, this problem can be its over appearance. Over appearance or excessive visibility, as we call of the gingiva, is not considered to be a good aesthetic sign. When we smile, only the papillary or the marginal gingiva should be visible, but not the main gums, as we can understand from certain pictures that we see of certain people. Now, this excessive visibility can occur due to a number of reasons. Can be occur due to your genetic predisposition. It can also occur due to a dysfunctional upper lip, which has a high frenal attachment. Now, these are all soft tissue examinations that can be ascertained and corrected by your practitioner in the dental setup. So, it is very important for every individual to go and get themselves assessed for people who want to redesign their smile. The gingival visibility can be reduced by the use of laser technology, by reshaping the gums, by recontouring the gums, by reducing the thickness of the gums, and the smile can be recalibrated. Another problem that a lot of people face is the dark color of the gums. In our dental office, a lot of young kids come and they talk about their gums appearing dark and patchy. Now, this is again a genetic predisposition which occurs due to excessive melanin pigmentation in certain individuals. But as I have said before, these are problems which can be combated. And therefore, the laser depigmentation of the gum line is a very common and forthcoming procedure in which the melanin pigmentation is removed and the gums attain or regain their pink vital look. This procedure may need a repetition after 6 months. However, we have seen that 90% of the patients do not have to go for a repetition of the procedure. Now, this in our language is called gum lightening, gum bleaching, and the problem that we name this problem as the chocolate gums. So the chocolate gums can be treated by laser bleaching of the gums. Now, the third problem that can occur in the gums are swollen gums or pudgy gums, and which can occur due to a lot of habits that the new generation has inculcated with them, and especially which include of vaping. Now, these problems, why I'm talking about the new generation, because we're talking about smile designing. So smile designing also appeals to the newer generation. So they have to understand that the problems that they introduce in their lives can have repercussions, but can be dealt with if they get aware at the right time. So the smoking and vaping also induces certain gingival problems, which can be dealt with by means of hypertrophy, tissue removal by the lasers or by surgical means. Smile is also contributed by the hard tissues. Now, hard tissue namely is first the bony contours, which pull my tissue, which provide the nasolabial folds. Hard tissue correction definitely is a surgical intervention. However, the smile that is being disturbed or is getting a bad look by means of the teeth can be corrected very easily in a dental office. The teeth also contribute to the smile by being in a proper alignment, by being of a proper color, texture, and being in a complete presence. Now, this can be corrected firstly and foremost, सबसे important is the color of the teeth. Now, the color of the teeth can be corrected by laser whitening or bleaching, in which we promise to give our patient a shade 2 shades lighter than the existing shade of his or her teeth. The second problem that can be a hindrance to the design of the smile is the malalignment. This malalignment of the teeth should be dealt confidently at a younger age, where we apply braces to set the crooked teeth straight. Now, this treatment, or the braces as we call it in common language, is an extremely common treatment, but still avoided by some due to certain misconceptions. For people who could not get their treatments done at the right time during childhood, another method of treatment that has come into being is the Invisalign, in which all the young people, be it office going or middle-aged, can still get their teeth straight and their smile beautifully designed. The third problem is when people do not have or cause any problems themselves, but have certain gaps in their teeth, and which lowers their confidence value. In those cases, we have a beautiful treatment in which we provide veneers or crowns and close these gaps, and also at the same point of time provide treatment that these gaps should not increase. Now, this treatment is a widely accepted treatment because of its shorter duration and more wide presence and acceptability. So veneers design our smile extremely beautifully and should be looked into by one and all. We should also remember that in certain cases, our jaw placements hinder the beauty of our smile. The jaw placements, whether it be the upper jaw or the lower jaw, can be in malalignment and give rise to what we call a forwardly placed jaw or the prognathic jaw. In those cases, surgical interventions can be played and your smile can be made beautiful. Remember, smile, as I have already said, is an identity of one's personality. It is one's duty to take care of it, and a smile so that all your problems can be set right. Thank you.